Today we will learn very important topic, that is bitumen. Bitumen is a word commonly heard. Advertisers claim that their product contains some vitamins or the other which are good for health. But what is bitumen? Does it really play an important role in our body? Vitamins are organic substances found in natural food in small quantities, needed by our body in trace amount, and they perform specific functions of growth, maintenance and reproduction. Vitamins, they are not synthesized in our body. They need to be supplied through the diet, except few which can be partially synthesized in our body. Example, vitamin D, folic acid, vitamin K. Many scientists have contributed the development of vitamins. The word vitamin was coined by Funk. He discovered water-soluble substances in rice polishing which cured beriberi. He described this substance as vital amines and named this substance vitamin. E was dropped later after discovery of similar substances, and it was realized that they were not just amine, they belong to a number of organic substances. Vitamins are vital substances. They support many physiological and biochemical functions. Vitamins do not provide energy, but they regulate the energy giving process in the body. Majority of vitamins acts as coenzymes required in a number of metabolic reactions in our body. In all, there are 13 essential vitamins. Each one has a special role to play within the body. Now we will learn classification of vitamins. Based on their solubility in fat and water, they have been classified as fat-soluble vitamins and water-soluble vitamins. There are 4 vitamins which come under the categories of fat-soluble vitamins. These are A, D, E and K. Water-soluble vitamins include vitamin B group and C. Now we will learn characteristics of fat-soluble vitamins. Fat-soluble vitamins can only be absorbed in the presence of fat. They are generally not affected by normal cooking methods. They can be stored in the body, and when required, body takes them out of storage. They should not be consumed in excess amount, because since they can be stored in the body, they can cause toxicity, and this phenomenon is called hypervitaminosis. They can be destroyed by rancidity because they are associated with the fat, and not eating fats and oil or eating fats and oils which are not absorbed in our body can cause deficiency of fat soluble vitamins. Now, what are the characteristics of water soluble vitamins? As compared to fat soluble vitamins, they are unstable, affected by heat, light, oxidation, radiation and contamination. These vitamins are easily destroyed or washed out during food storage and preparation. For example, if food is cooked in excess of water and water is drained away, then it causes great loss of water soluble vitamins. And by adopting a correct method of cooking techniques, we can conserve water soluble vitamins to a great extent. Water soluble vitamins cannot be stored in the body. They need to be obtained from food every day. They are easily absorbed in our body, and excess intake will not cause any toxicity because they disperse in the fluid and excreted through the urine. These vitamins are widely distributed in foods. Let us begin each vitamin in details. Today we will cover fat soluble vitamins. Vitamin A, discovered by McCollum and Davis in 1913. Pro-vitamin A activity of beta-carotene was established by Murray in 1930. Vitamin A and its derived retinoids are required for vision, growth, reproduction, epithelial cell differentiation and mucus secretion. There are 2 major forms of vitamin A. One is retinol, another is beta-carotene. Vitamin A is found in animal foods in the form of retinyl palmitate. Plant do not contain vitamin A, but it contains its precursor or provitamin A, that is carotenoids. Carotenoids are yellow and orange pigments found in plant. Vitamin A is an alcohol. Empirical formula of retinol is C20H29OH. It has been named retinol because it has a specific function in the retina of the eye. Retinol, it contains one beta ion ring and a side chain containing alcoholic group and 4 double bond. Due to alcoholic group, it forms ester with acid such as palmitate and acetate, and due to presence of double bond in the side chain, it is destroyed by oxidation. Other vitamins of vitamin A are retinol, that is aldehyde, retinoic acid, that is acid. Carotenoids are 40 carbon unsaturated hydrocarbons. There are different types of carotene found in food. These are alpha, beta, gamma and cryptoxanthin. Among these, beta carotene is most biologically active. It has a symmetrical structure and the molecule can split into half to give 2 molecules of vitamin A. However, the conversion and absorption in our body is not so perfect, and the conversion varies from 25 to 50%. Utilization efficiency of beta carotene is generally considered as 1/6 of the retinol for the humans. In other words, 1 gram of beta carotene has the same biological activity as 0.167 gram of retinol. Activity of vitamin A is expressed in international unit, 1 international unit being equivalent to 0.3 microgram of retinol or 0.6 microgram of beta carotene. Now it is expressed in microgram of retinol or microgram of beta carotene, and most recently retinol equivalent has been adopted by many countries. 1 retinol equivalent is equal to 1 microgram of retinol, it is equal to 6 microgram of beta carotene, and it is equivalent to 12 microgram of other provitamin A carotenoids. Now we will learn functions of vitamin A. The most important function of vitamin A is in vision. It is essential for the night vision. It occurs in the retina of the eye and required in the process of vision to adjust to light of varying intensity. Retina has 2 receptor cells, light receptor cell. One is rod, another is cone. Rod is sensitive to dim light and cone is sensitive to bright light and also colored light. Rod contains one pigment, rhodopsin. It is conjugated protein made up of 11 cis retinal and protein opsin. 11 cis retinal is vitamin A, and the rhodopsin is photosensitive. When light falls on retina, the conversion of retinol to retinal and stereochemical changes of vitamin A molecule, that is from 11 cis retinal to all trans retinal occurs. During this process, vitamin A molecules are used up. If more vitamin A is not present, then retina is not able to adjust to light of varying intensity and night blindness occur. Other function of vitamin A is for the health. It is required for the health of epithelial tissue. Epithelial cell line our outer body surface, that is skin. It line major cavities and tubular system in our bodies. Deficiency of vitamin A causes thickening of, or you say keratinization of epithelial tissues, and the tissues which are affected are salivary gland, eye, skin, sex organs and respiratory tract. In vitamin A deficiency, myelin sheath of nerves are adversely affected. Vitamin A is essential for normal bone formation. It is essential for incorporation of inorganic sulfate in mucopolysaccharide synthesis. Vitamin A is essential for the synthesis of mucoprotein and glycoprotein. In vitamin A deficiency, normal reproduction does not occur due to infertility in male and failure of female to conceive. If conceived, then abortion of fetus occur. It protects from infection. Vitamin A is essential for integrity and functioning of mucous membranes, and in the deficiency of vitamin A, mucous membranes becomes dry, flaky, porous and unable to perform their protective functions, and bacteria have ready access, and it lowers the resistance to certain infection and the person becomes susceptible to infection. Vitamin A is essential for the growth and development of soft tissue and skeletal tissue. Vitamin A deficiency may be due to the dietary lack of vitamin A or provitamin A or poor absorption of these. Vitamin A deficiency results in growth failure and it affects eye, skin and the immune system adversely. The term Jabth-Alma encompasses all ocular manifestation of vitamin A deficiency. Nutritional blindness due to the Jabth-Alma is an important public health problem. It includes the structural changes affecting conjunctiva, cornea and occasionally retina, and also the biophysical disorders of retinal rod and cone functions. Earliest symptom is impaired ability to see in night or dim light. Next stage is inability to see in night or dim light, called night blindness. The next sign is the conjunctiva becomes dry, thickened, wrinkled and pigmented. This is due to the keratinization of epithelial cell. The pigmentation gives the conjunctiva a smoky appearance. Without spots is more an extension of xerotic condition. Grayish, glistering white plaques, usually triangular in shape, is present on the conjunctiva, usually on the temporal side of the cornea. Later and more serious stage, when dryness spreads to cornea, the cornea becomes dull, hazy and loses its transparency, and this is due to the hardening of the epithelial tissue covering the cornea. When xerosis of conjunctiva and cornea is not treated, it may develop into the condition called keratomalacia. In keratomalacia, cornea becomes soft and may fall off and result in complete blindness. This is medical emergency stage, and person can become complete blind. Vitamin A deficiency also causes skin changes. Follicular hyperkeratosis is a condition in which skin becomes rough, dry, scaly, papules of varying size arising at the site of upper arm, thigh, shoulder, back and buttocks. This is due to the keratinization of the epithelium. As I discussed in the function of vitamin A, it lowers the resistance of the body to some infection because the mucous membrane is affected and person becomes susceptible to infections. Now come to the source of vitamin A and beta carotene. Fish liver oils are the richest known source of vitamin A, but they do not form the part of the diet. They can be taken as supplement. Among dietary sources, liver is the rich source of vitamin A. Other good sources are butter, ghee, egg, milk powder. Plant foods do not contain vitamin A, but it contains its precursor beta carotene, and yellow and orange fruits and vegetables such as carrot, mangoes, papaya, pumpkins and green leafy vegetables provide good amount of beta carotene in our diet. Now, RDA for vitamin A. An adult man and woman needs 600 microgram of retinol or 4800 microgram of beta carotene. The need increases during pregnancy, lactation and infancy. In infancy, 350 microgram retinol is needed, and which rises gradually to the adolescence. Prolonged intake of excessive amount of vitamin A can cause toxicity, and symptoms include anorexia, fatigue, weight loss, irritability, skin lesions, joint and bone pains, spleen and liver enlargement, loss of hair and increased intracranial pressure. Now we will learn vitamin D. Vitamin D was isolated in crystalline form in 1930, and it is also called calciferol. It is sometimes called sunshine vitamin because our body can convert 7-hydrocholesterol, which is found, it is a ester found in our skin in the presence of sunlight, to vitamin D. Vitamin D activity is shown by a group of chemical substances called sterols. These are wax-like substances, insoluble in water, soluble in fats. Vitamin D's are stable to heat, acid, alkalis and oxidation. There are at least 10 sterols which are pro-vitamin D. But two major sterols that can be converted to vitamin D by the action of UV light are: first is ergosterol. It is found in plant tissue, and in the presence of sunlight it can be converted to ergocalciferol or vitamin D2. Second is 7-dehydrocholesterol. It is found in animal tissue, and it can also be converted to cholecalciferol or vitamin D2 in the presence of sunlight. Vitamin D is remarkably stable. Storage, processing and cooking do not affect its activity. The most important function of vitamin D is to produce a hormone called 1,25-dihydroxycholecalciferol. It is also known as 1,25-dihydroxy-D3 or vitamin D3 hormone or calcitriol. It is formed by liver and kidney, and the hormone is essential for the overall effect of dietary vitamin D, which includes promotion of growth, mineralization of bone and teeth, increases intestinal absorption of calcium, it increases phosphate transport in the intestine, maintain proper calcium and phosphorus level in serum, increases the reabsorption of calcium by the kidney. Vitamin D deficiency causes rickets in children and osteomalacia in adults. Ricket in children is characterized by poor growth and bone deformation such as craniotabes, that is thinning and wasting of cranial bones in infant. The skull becomes soft and pliant. Delayed closure of anterior fontanelle. Generally it is the breathing space in the skull of the infant and generally closes by 2 years, but it may be delayed in rickets. Bossing of the frontal and parietal bones, bowed legs, knock knees, beaded ribs, pigeon chest, enlarged joints, deformities of the spine and pelvis, and skull deformation. The teeth of children may fail to develop normally because of poor calcification, and they may have pits and cracks which render them prone to decay. In young girls, improper development of pelvic bone may result in difficult deliveries in adult life. Osteomalacia is a ricket-like condition occur in adult, and osteomalacia is due to the, generally it is found in those women who live indoors due to social reasons and had many pregnancy and nurse their children for prolonged periods. Then they may develop this condition, osteomalacia. In osteomalacia, bones become soft and too weak to bear the weight of the bodies. It may bend or break. Vitamin D is measured in terms of international unit of vitamin D3. One international unit is equivalent to 0.025 milligram of pure crystalline vitamin D3. Infants and preschool children and adolescents need 10 mg vitamin D. Older children and adults need 5 mg, and expectant and nursing mothers need 10 mg. In tropical climate, half the above amount will be adequate, as the body itself makes vitamin D when it is exposed to direct sunlight for some hours daily. The major source of vitamin D is irradiation of the skin with the sunlight. Foods are not very good source of vitamin D. Cod liver oil contains high amount of vitamin D, but they do not form the part of our diet. They may be used as supplements. Foods like liver, butter, egg, cheese contain a small amount of vitamin D. Fish contain appreciable amount of vitamin D. Vitamin D has serious toxicity potential. Earliest sign is loss of appetite, nausea and vomiting, intense thirst, polyuria, and if the excessive amount intake is continued, then it may cause hypercalcemia, stone formation in kidneys, and calcification of soft tissues such as arteries, kidneys and lungs, and leading to death. Vitamin E, also known as tocopherol. The link between vitamin E deficiency and reproductive failure in rat was first discovered in 1922 by Herbert Evans and Catherine Scott Bishop. It is also known as anti-sterility vitamins. Vitamin E activity in food is derived from 4 tocopherols and 4 tocotrienols. Alpha tocopherol is the most active form of vitamin E. The other compounds such as beta, gamma, delta tocopherol and alpha, beta, gamma and delta tocotrienols have lower biological activities, estimated to be 1 to 50% of alpha tocopherol. Tocopherol contains 6-hydroxy chromin ring with isoprenoid side chain. This chromin ring is responsible for the antioxidant role of the vitamin E. Vitamin E is highly susceptible to destruction by oxygen, metal, light and deep fat fan. It is heat level vitamin. As a result, prolonged food storage lowers the vitamin E content of the food. The requirement and function of vitamins E are dependent on the quantity of PUFA present in the tissue and selenium status of the animal. Now we will learn functions of vitamin E. It is well recognized antioxidant in vivo. Its role in the body appears to be related entirely to its antioxidation role, and it prevents the formation of peroxides. It prevents the membrane, cell membrane from the damage caused by free radicals and peroxides. And this ability of vitamin E to protect the cell membrane is related to aging. It has protective role in prostaglandin mediated disorders such as inflammation, premenstrual syndrome and circulatory irregularities like platelets stickiness and nocturnal leg cramps. Vitamin E protects erythrocyte from hemolysis due to its antioxidation role, essential for normal reproduction in several species of animals and also in human beings. Protect the organism against the damage likely to be caused by nitrosamines. Generally, nitrites are used in the preservation of the animal foods. It is used in curing and pickles. Vitamin E inhibits the conversion of nitrites to nitrosamines, which are strong tumor promoters. Vitamin E helps to increase the activity of selenium, compounds present in traces in animal tissue. It protects vitamin A and C and essential fatty acids. Vitamin E is not associated with any specific disease. Therefore, it is also known as vitamin in search of disease. A primary vitamin E deficiency is rare because widespread use of vegetable oils. However, vitamin E deficiency may be found in person with fat malabsorption syndrome and premature infants. Preterm infants are particularly susceptible to hemolytic anemia. However, in severe deficiency of vitamin E, it may lead to increased hemolysis of RBC, proteinuria, deposition of brownish steroid pigment in smooth muscle, and muscular dystrophy. In animals, reproductive failure, liver necrosis, erythrocyte, hemolysis, anemia, muscular dystrophy, deposition of brownish steroid pigment in uterine muscle, skeletal muscle, and sex glands have been reported in vitamin E deficiency. Vegetable oils are the rich source of vitamin E. Nuts and oilseed and grams contain good amount of vitamin E. Whole cereal and millets are fair source of vitamin E. It is measured in terms of milligram of DL alpha tocopherol acetate or as tocopherol equivalent. Daily allowance for infant is 3 to 4 mg alpha tocopherol equivalent. Children and adolescents need 10 mg alpha tocopherol equivalents. Adult male and female need 7 to 13 milligram alpha tocopherol acetate, and during pregnancy and lactation additional 2 to 3 milligram over the non-pregnant allowance is required. Vitamin E is least toxic among all fat-soluble vitamin. However, excess consumption may lead to elevation of serum lipids, impaired blood coagulation, reduction of serum thyroid hormones. Now we will learn vitamin K. Vitamin K was discovered in 1934 by Danish scientist named Dam. A large number of chemical compounds having the structure of 2-methyl-1,4-naptoquinone with side chain substitution on the third carbon atom poses vitamin K activity. In nature, vitamin K exists in two forms. First is phyloquinone, which is obtained from the plant, and second is menaquinone, which is obtained from the animal. However, bacteria can synthesize menaquinone in our colon. And third is menadione. It is synthetic analog of vitamin K and it does not have side chain, and it is also considered as provitamin K because in the liver it is converted to vitamin K2. The basic function of vitamin K is in the blood clotting process. It is essential for the formation of 4 blood clotting factors in the liver. It is factor 2, 7, 9 and 10. These 4 factors along with other factors including calcium and phosphatide react to form thrombin, which in turn catalyzes the conversion of fibrinogen to fibrin and which ultimately polymerizes to form blood clot. Deficiency is rare. It is synthesized in the intestinal tract by the bacteria, nor RDA is made. However, vitamin K deficiency may be manifest in the form of defective blood clotting in patients with chronic fat malabsorption and in persons who are on long-term antibiotic and anticoagulant therapies. Newborn infants are susceptible to hemorrhagic diseases due to the deficiency. Green leafy vegetables are rich source of vitamin K. Green leafy vegetables like spinach and vegetables belonging to brassica family like cabbage and broccoli, they contain rich amount of vitamin K. Among the animal food, liver is the rich source of vitamin K. Pulses are good source. Cereal and vegetables provide fair amount of vitamin K in our diet. High dose of vitamin K can reduce the effectiveness of anticoagulant drugs such as warfarin, which is used to prevent blood clotting. People taking these drugs should maintain a consistent daily intake of vitamin K. Toxicity from the food is rare because the body excretes vitamin K much more rapidly than any other fat-soluble vitamins. And that's all about fat-soluble vitamins, and in next class we will discuss water-soluble vitamins. Thank you.